Good morning. My name is Andrew Alleman. This presentation is for Nursing Theory 5310. Today I'm going to be discussing the importance of nursing theory, introducing nursing theory and its purpose, discussing theory in relation to nursing as a profession, providing examples of nursing theory and how its core values align with professional nursing values, discussing nursing as a discipline and how theory has shaped it. Also, we'll explain how the impacts of the science of nursing and research. And we'll close out with a reflection and how studying theory has changed my perspective of how I conduct myself within the nursing profession. So nursing as a profession. Theory provides us the framework to understand patients' health, environment, and practice. What does that mean? It's why we do what we do, just not how. It's not just the how do we perform tasks. It's not just about providing medication to a patient, but the how we provide that medication and knowing what is this medication for and what is the effects and what is the outcomes. Theory elevates nursing from a technical role to a thoughtful, evidence-based profession with a core professional values of compassion, advocacy, accountability, respect for human dignity, and patient-centered care. So, utilizing Jean Watson and her work on philosophy of caring, Miss Dr. Watson had developed a theory of human caring. She emphasized caring relationships and authentic nurse-patient connections. And what was the purpose of those connections is to provide a human experience, a human background behind the science. And her theory promoted holistic care, addressing the physical, emotional, social, and spiritual needs of the patient, a total care process. And how this theory aligned with the profession of nursing is it promoted respect for human dignity, promoted compassion, relationship-centered care, and reinforced that nursing isn't just a science. It is a science, but it's also an art form, a way we practice, not just what we practice, but how we practice. So nursing as a discipline. A discipline is defined by having one unique body of knowledge, a separate sphere, separate scope of knowledge. And nursing theory helped establish nursing as a distinct academic and practice discipline. So without theory, nursing would be considered a support role to the physician care plan. We would not have our own basis of scientific study. So, this clarifies that nursing focuses on the human response to health and illness and the patient as a holistic concept, not just a body. Many times in the nursing profession, it is easy to forget that there is a person behind the task. And that is one of the key concepts of nursing within the profession. So the development of the core concepts of person, health, environment, and why this is important is that these theories drive a strengthening foundation that provides us a guideway, a pathway to establish nursing education curriculum, standards of practice, and most importantly, a scope of our practice that defines us from everyone else that's providing patient-centered care practice. And as a result, nursing has developed a clear profession identity and autonomy that allows us to develop our own profession and develop our own means and necessities within the healthcare setting. So, what is the theory impact on the science of nursing? So, nursing is not only a profession and discipline, but it is also a science. And theory provides framework for us to conduct research and evidence-based practice and record results to determine if a practice is successful, unsuccessful, needs reevaluation. It guides research questions, study design, data interpretation, and applications for the findings. For example, for Watson's theory of human caring, researchers might utilize the behavioral impacts of patient outcomes. They could measure anxiety, patient satisfaction, recovery rates. We can create a definition of caring and what it means, how it is evaluated. Theory ensures that research is purposeful and connected to nursing knowledge and nursing application. So this strengthens evidence-based practice and improves patient care outcomes. So conclusion and personal reflection. Nursing theory supports core professional values. It establishes nurses as a distinct discipline and provides us our own body of knowledge. It also provides us a pathway for evidence-based practice. And so how has nursing theory changed how I view nursing practice? I would say the simplest answer to how nursing theory, though we conduct these things that we talk about with Watson, with Roy, with Swanson, with these other theorists, what this theory gives us is a previously established pathway on how we can conduct our processes, and most importantly, it gives us a guideline of how we establish our own research questions, how we start developing our own studies, and be able to guideline them along a pathway within the nursing understanding and platforms so that we can develop our profession further. Thank you very much. Have a wonderful day.